should you swab your nose, throat, or both for COVID-19 rapid tests? Many Americans are familiar with the rapid antigen tests for COVID-19 that involve swabbing the nose. But some new evidence suggests a saliva sample could boost the test's accuracy. Experts agree on one thing: if you are going to test both the nose and throat, swab the throat first. Robert Wachter, MD, shared a story on Twitter about how his symptomatic son initially tested negative using a rapid nasal swab test. After a search for additional tests, sampling both his throat and nose yielded a positive result. Two recent preprint studies support the saliva swabbing strategy. One study by Gert Moray, MD, and colleagues points to superiority of saliva over nasal swabbing for detecting coronavirus infection. The researchers compared the accuracy of saliva and nasal sampling on 382 symptomatic people who also had PCR tests done. The saliva rapid test findings agreed 100% of the time with the standard laboratory-based PCR test for presence of the Omicron variant, Murray and colleagues at the University of Cape Town and the National Health Laboratory Service in South Africa reported. In contrast, the nasal rapid test results agreed 86% of the time. The results, the authors say, may mean we need to reassess the typical diagnostic testing done for suspected cases of COVID-19. Saliva sampling and throat swabbing are not necessarily the same thing, Christina Wojuoda, MD, chair of the College of American Pathologists Microbiology Committee, says. Participants should not have had any food, drink, tobacco or gum in the 30 minutes preceding saliva swab collection. More research is needed to nail down the best technique for saliva collection, says Wojuoda, who also is director of the Clinical Microbiology Laboratory at the University of Vermont Medical Center. We know from rapid strep testing studies that accurate sample collection from the back of the throat is not easy, Michael Blavis, MD, Chief Medical Officer at Anavasi Diagnostics, says. A throat swab performed by a doctor, nurse or other healthcare professional in general will always be more accurate than one performed by someone less familiar with proper technique, he said. The Anavasi diagnostic test is a rapid molecular test based on lower nose swabbing that can return results in 30 minutes. This is very different from saliva antigen tests, Blavis said. However, if the study findings and conclusions are validated by others and it is true that Omicron causes higher viral shedding in the mouth or saliva than the nose, companies will need to consider redesigning their tests, he added. Another caveat on nasal rapid testing? Researchers published a different preprint study comparing the performance of saliva-based PCR tests versus nasal rapid antigen tests in 30 participants who tested positive as part of a screening program. Blythe Adamson, Ph.D., mile/hour, and colleagues reported that most people with Omicron tested positive by PCR days before antigen tests yielded the same result. In contrast, for asymptomatic coronavirus patients, it looked like antigen tests performed pretty poorly, Wojuoda says. The Adamson study also confirms a widespread belief that rapid antigen tests are often not sensitive enough to diagnose an infection when it is early or symptoms are mild and little virus is shed, Blavis said. My clinical experience in the emergency department regularly showed, early in the pandemic, that antigen tests were not reliable for our clinical use, Blavis added. Blavis recommended consulting a regularly updated FDA website that lists antigen tests that failed to recognize the Omicron variant reliably. Some experts advocate swabbing both the throat and nose, and there is literature support for this being more accurate than just throat swabs alone, Blavis said.